Hello, AMEE 2024 participants. There is such a great pleasure for me to share my talk about refreshing course of pediatric seizure for medical students combined with fast-track EEG for the better care in rural areas. First, I have no conflict of interest to declare. In rural area of Thailand, there's a limitation of specialists, especially technology, but there are patients about 2,000 to 3,000 patients per year. So most of the healthcare providers in rural areas are general practitioners. Our hospital, Maharat Ratchasima Hospital, acts as the leading tertiary care facility in Ratchasima, comprised of 4 provinces, Nakhon Ratchasima, Vitchayaporn, and Saegow. Our referral system and healthcare system, the specialists provide tertiary care, while general practitioners handle initial treatment and diagnosis at primary and secondary care hospitals. Patients are referred to tertiary care based on specific conditions. So there's a problem because of the limitation of specialists. The ratio of one pediatric neurologist to 3,000 patients. This caused the limitation in assessing the specialists for diagnosis and treatment, and caused the risk for the patients as the delay in diagnosis and treatment, such as not being prescribed the anti-seizure medication, not receiving the correct diagnosis, such as misdiagnosis of epileptic spasm, inappropriate treatment, such as multiple dose of diazepam instead of epilepticus, leading to complications. And there's also an impact on the general practitioners, as the general practitioners lack of confidence and are concerned about the diagnosis and treatment. They also face conflicts with parents due to parental concern. In designing the curriculum to solve this problem, we designed the curriculum for medical students. We focus on fundamental knowledge and clinical reasoning for 4th to 5th year students. And for the 6th year medical student, we have established the refreshing course aimed to enhancing learning through competency-based education. This picture shows that in the 4th to 5th year, we include teaching on seizure, epilepsy, and status epilepticus, followed by the refreshing course in the 6th year that emphasize the critical and practical points for the learner. Additionally, we incorporate healthcare system training to equip the graduates with the knowledge that necessary to practice for the general practitioner. When they graduate, they will be the general practitioner and have a real practice in rural areas. This slide outlines the core knowledge and teaching method for the 4th to 5th year medical students. Utilize the active learning technique, such as flipped classroom, team-based learning, and simulation technique. The refreshing course of the 6th year medical student emphasizes the core knowledge while also incorporate the healthcare system, clinical practice guidelines that simplify for the general practitioner. It includes a consultation method and endorse the competency-based learning as well as the continuing professional development. This is the process to improve the quality of diagnosis and treatment. First step, we increase knowledge or learning. For the medical student, we use clinical reasoning, clinical exposure as a refreshing course in the 6th year medical student. And second, we combine the fast track and clinical practice guidelines. We develop a Google form that's easy for the general practitioner, and we have the service for the primary care physician to consult the expert at the tertiary care. And the evaluation, we evaluate for the benefit for the patient, such as the appropriate treatment, appropriate referral, the reduced risk and the reduce of inadequate dosage and medication. And we also evaluate the benefit for the learner, such as the reflection from the learner. These contents of clinical practice guidelines has been tailored to be suitable for primary care hospital. We implement the diagnosis for pediatric seizure, epilepsy, status epilepticus, and we implement the investigations such as basic laboratory indication